Bonjour tout le monde. Alors aujourd'hui, c'est une belle nouvelle pour la santé des Canadiens. Pourquoi en 2026, un médecin de Val-d'Or ne peut-il pas accéder au dossier médical d'un patient de Rouyn-Noranda qui consulte après un accident de chasse? Why must a patient from Sydney, Trois-Rivières, Peterborough, Regina or Victoria get a printed copy of their file to bring to a specialist in Halifax, Montreal, Toronto, Saskatoon, or Vancouver? Why does a nurse have to call the only person for miles around who can fix their fax or else be unable to send a prescription to the local pharmacy because it is a wrong number? And by the way, we are in 2026 and we are a G7 country. Le temps que les patients passent à l'hôpital à attendre que leur dossier soit imprimé est du temps pendant lequel ils ne reçoivent pas de soins, ne se rétablissent pas et ne contribuent pas à notre société. Le temps que les professionnels de santé perdent à imprimer, à trier des documents, est du temps qu'ils ne consacrent pas à ce qu'ils devraient faire et veulent faire, soigner les gens. Ces défaillances ont des conséquences réelles et tragiques. Ask Terry Price. Terry's brother, Greg, was a healthy engineer from Alberta who faced systemic failures in our healthcare system. Like many others, he experienced delays due to poor coordination and inaccessible health information. He died of cancer in 2012. He was 31. Today is World Cancer Day, and we remember Greg Price and the many cancer patients who we failed because of unnecessary silos in our healthcare system. This is why today's legislation is so important. We need to break down those silos. So we are changing the rules and we are building the health data infrastructure Canadians deserve. Le projet de loi S5 permettra aux patients et aux professionnels de la santé de mieux prendre soin d'eux-mêmes et des autres. La loi sur les soins de santé connectés renforcera notre système de santé en exigeant des entreprises qui fournissent des services de santé numériques qu'elles adoptent des normes communes en matière de données de santé. C'est essentiel pour éliminer les obstacles, améliorer la connectivité entre les systèmes et permettre de meilleures recherches. The Connected Care for Canadians Act is also about safety. Let's be clear, data will remain strictly confidential. No one will be forced to share them, and data will be used only under the strict limits of the Privacy Act. By adopting common standards, including security standards, we will ensure healthcare serves patients, not the profit of shareholders. I want to thank Terry Price, his family, and the Greg Wings Project, as well as many others, including the Canadian Institute for Health Information, the Canadian Medical Association, and InfoWay, for their continuous advocacy. Je veux aussi saluer le travail de mes prédécesseurs qui sont passés au ministère de la Santé avant moi, et j'ai le plaisir d'avoir avec moi Ginette Petit-Pateleur et Jean-Yves Duclos. I am already collaborating with my provincial and territorial counterparts to develop the regulations. And I welcome our shared commitment to interoperable digital solutions that enhance connectivity in our healthcare system. J'ai hâte de travailler avec les sénateurs et tous les élus pour faire adopter ce projet de loi. Il est une étape cruciale vers un système de santé plus connecté qui soutient les Canadiens. Merci à vous tous d'être venus assister à cette importante annonce pour les Canadiens. I will turn now to Dr. Burnell from the Canadian Medical Association. Dr. Burnell.
Thank you, Minister Michel. Good afternoon, everyone. Bonjour à tous. This legislation represents an important moment for patients, for physicians, and for Canada's health system as a whole. It's a step that many of us have been working toward for a very long time. This bill will make it easier for people to get the quality care they need and easier for clinicians to provide it. Think of the individual that presents to the emergency room with their chest pain. They see the emergency doctor, they have tests done, they have an ECG, they're referred to a cardiologist, they have a stress echo, and then they're back in their family doctor's office with new medications and he has no records. And that person is saying, how is my life going to change? What am I at risk? Am I going to live to be a healthy individual and a healthy senior? So this is so critically important. When personal health information can move securely between clinics, hospitals, labs, and patients themselves, everyone benefits. Care is faster, safer, and more coordinated. These changes will also empower our patients. When people can reliably access their own health information, they're better able to make decisions, ask questions, manage their care in partnership with their physicians and other health professionals. That's the kind of modern, connected system we should have in Canada. Reaching this point has taken real dedication and reflects the commitment of many individuals and organizations. In particular, I would like to acknowledge the College of Family Physicians of Canada and the Royal College of Physicians and Surgeons of Canada for their collaboration and shared commitment to improving how care is delivered in this country. We encourage the swift passage of this bill and hope to see a more connected, efficient, and equitable health system for everyone in Canada. The CMA stands ready to work with government and partners across the health sector to support the goal and to help make the promise of connected care a reality. Thank you, merci, miigwech. I'm now pleased to invite Anderson Chuck, President and CEO of Hi to the podium.
Thank you very much. Ça fait un plaisir d'être ici. Today is an important day for patients, health systems, and Canadians. Canada's diversity and single-payer model has created one of the most valuable health data sets on earth. Canadian health data is truly another one of Canada's great natural resources, but too often the benefits are missed. Canadians feel its effects every day. Through delayed care, missed insights, having to repeat information over and over again, leading to the system that cannot respond to their needs quickly enough. When data can't move, it cannot deliver value. That is why today is significant. It is critical that there be clear, connected, trusted rules for how data is used. And this is why today this legislation is critical, because truly it puts patients first, helping to provide the best possible outcomes and quality of life. At the same time, this is foundational to help build a data capability that enables research, innovation, and AI at scale for the country. This is really about connecting data across jurisdictions for decision makers, connecting researchers and innovators to the information they need to lead to new, exciting discovery, connecting for better decisions, a more sustainable health system, and a stronger, more resilient Canada. CIHI is proud to work with governments across the country and the Government of Canada to build a connected, secure, and trusted data environment that delivers real value for patients today and prosperity for Canadians tomorrow. It's a privilege to be present today at this pivotal announcement. Thank you very much. Merci beaucoup.
With the Canadian Press. This bill was first introduced 2 years ago. I'm wondering if reintroducing it today means that we're behind on getting patients access to their own digital records and care?
Can you repeat your question, because I
Yeah,
didn't get it?
absolutely. So with the bill being first introduced in 2024, I'm wondering if that means that, reintroducing it today, does that mean we're behind on getting patients access to their records and into care?
Well, the good news is today we are tabling it. So, yes, it was introduced in 2024, I think, and then we had the election, so this is why it didn't move on. And right now we are ready to move forward. It will be starting at the Senate, hoping that the Senate will work very fast on it. And then, because it's really a great news. It's great news for doctors, for nurses, for patients. You know, the number of support that we got when we did our consultations and when we announced that we were tabling this, it's huge. So I think it's a good news today for Canadians.
Totally. And then I'm also hoping you can just clarify why the bill is being introduced in the Senate rather than the House of Commons.
I don't think there's, well, I think we have a number of bills in the House of Commons, and I think to go faster, we moved it at the Senate, and the Senate was willing to take it, so this is the only reason why.
Minister, if I could ask you another health-related question. Your government promised to help Canadians injured by vaccines, but so far I believe only 234 people have received any help from your government, and thousands are caught up in red tape. I know BIAC is going to take over the program in April. What changes is your government going to make this right with Canadians?
Well, as you know, we moved during the pandemic. After the pandemic, we moved fast with an independent provider of service, and as you know, we had a lot of challenges. Now we hope to move the program back to the government, so we will have, you know, we will be responsible for it. So I'm hoping after April to be able to move it within government, and then to have a better answers for Canadians.
We've heard about some wait time problems with applications, that people who are vaccine injured are getting diagnosis delayed due to lagging healthcare systems, as you mentioned earlier, maybe not always coordinated. Are you considering removing the 3-year limit for applications to that program?
Not for now, I would say. We are considering everything, but first thing, we are getting the program back in the public service.
Do you have any message to those who perhaps were denied care during the program due to those delayed diagnoses?
Well, as you know, vaccine injuries are very specific. And as every program, when you are building something, you have to choose what you are considering and not considering. We are going to do our best to support Canadians, but it's really specific, and it will be on doctors and experts to decide who got a real vaccine injuries, if it's not something else. So I cannot comment on this specifically. Thank you.
If I can ask one last question. You mentioned that the health data system is siloed and fragmented. I'm wondering when can Canadian patients expect to have a healthcare system that is digitally coordinated and connected, and what steps exactly do you plan to take to achieve that?
Well, I think the first step is the bill. And you need to know that I'm really working. I raised it with my counterparts during my last FPT in last October, and quite everyone is on board. So people understand the needs to have those data and to have connected care. Now we need to work on regs, on a number of things with provinces and territories also making sure that everyone is comfortable. Because the goal now is to support a better health for Canadians. This is the goal. It's not, the federal government wants to go and do things. No, it's for Canadians. And really, when I was touring on the ground, and even more when I go to remote communities, you can see the challenge. It's really tough on doctors and also on patients. So I hope we'll be moving and implement as fast as possible, but let's pass the bill first.
Thank you.
Well, thanks for everyone for showing up, and thanks for coming.
Thank you.